Hi, I'm Dr. Danny Barrington, and I'm the principal investigator of this project, Understanding Children and Their Caregivers' Experiences with Incontinence in Humanitarian Contexts. This video is a brief introduction to the project, why the topic itself is important, how we're planning to investigate it, and how we intend for the results to be used in practice after the project is finished. This is a grant under ELRA's Humanitarian Innovation Fund, with the funding provided by the Ministry of Foreign Affairs of the Netherlands. The project is taking place in Bangladesh and in Uganda, and is led overall by the University of Western Australia and the University of Leeds, with assistance from the University of York. In Uganda, we're partnering with Plan International UK and Plan International Uganda, and we also have research assistance provided by Ugandan Christian University. In Bangladesh, World Vision are the implementing partners with assistance from UNICEF Bangladesh, and we have a local research assistant, Mahbub Alam, assisting us there as well. We also have a team of advisors who are humanitarian and incontinence specialists, and also specialists who focus on conducting research with children. Overall, what we really would like to understand is what are the experiences of children from the ages of 5 to 11 who live with incontinence in humanitarian settings, and also what are the experiences of their caregivers in these situations. So I guess the first question you're asking yourself is, why are we undertaking this research? So incontinence is the involuntary leakage of urine or feces, and this can happen when people are awake and when they're asleep. But we expect that above the age of about 5 years, children will be able to control their leakage of urine and feces, both, again, when they're awake and when they're asleep. So we know that accidents do happen, but bedwetting and leakage during daytime hours shouldn't be something that's happening regularly. When children and people of all ages actually experience incontinence, their physical health can suffer. They can experience rashes, infections, pressure sores, dehydration, and other potentially harmful outcomes. When people experience incontinence, they also often miss out on educational and livelihood opportunities, and can also have increased protection risks because of the stigma associated with this condition. So anecdotal evidence from our colleagues around the world suggests that in humanitarian settings, children actually experience a higher rate of incontinence than elsewhere in the world, and that this is likely due to the trauma that they've lived through and the ongoing stress that they are exposed to on a daily basis. This seems to particularly impact on a higher incidence of bedwetting. So the research we are working on here has been designed to understand what it can be like for children who experience incontinence in the refugee camps of Cox's Bazar in Bangladesh, and in resettlement and host communities in Adjumani in Uganda. So early in the project, researchers and the advisory group developed a scope for the project and some preliminary data collection tools that we thought might work in the research settings. We then held workshops, 2 in Uganda and another 2 in Bangladesh, with our Plan Uganda research colleagues, as well as our World Vision Bangladesh research colleagues, to ensure that the data collection instruments that we had developed and the way that we had hoped to recruit and involve participants were actually contextually appropriate and would allow us to gather the necessary information to actually answer our research questions and understand what these experiences are really like on the ground. The primary research activity of this project is that we will be inviting children to take part in a focus group discussion, which is a storybook activity where they're actually involved in developing characters and storylines themselves. So we think that sometimes children don't want to use the toilet, or they can't use the toilet, and so therefore they might wet themselves or poo on themselves during daylight hours and perhaps during nighttime hours as well. So the idea of this storybook activity is getting children to articulate to us how an imaginary child who might wet themselves or poo on themselves actually experiences a day in the life in one of these settings. So the idea is that this will give us some insight into how an imaginary child might be feeling, how they might be treated by others in their community, and also to get a better understanding of the children's experiences and the availability of appropriate toilets and other water and sanitation and hygiene facilities, as well as any existing stigma around incontinence, whether children are punished, for example, for experiencing this, and generally how they are treated by others around them. We're also going to invite the caregivers of the children from the focus group discussions to take part in a one-on-one interview to understand their experiences with incontinence, either with their own child or in general in their community, or even their own experiences if they have incontinence as well. And alongside this interview, we're also going to be conducting an inspection of the household or community sanitation facilities that the children from the focus group are most likely to use during the day and night. And that will help us evaluate against the new child fund framework whether these toilet facilities are actually appropriate for children aged 5 to 11, based on official guidance, but also in the opinions of the caregivers and what their children have told them. What we'd really like to find out here is what support can be provided for children who don't want to use these toilets or who can't use these toilets. And therefore, we really need to understand from the perspective of the caregivers, where are the big issues for the children that they care for. We're also going to be conducting a series of key informant interviews with people who actually work in humanitarian contexts, particularly those who work in water, sanitation and hygiene, protection, particularly working around children in these settings, to try and understand how they've perceived experiences of incontinence and perhaps a lack of appropriate water and sanitation facilities for children in this age group. Okay, so what we're hoping from these 3 sets of activities is that we will be able to get a better understanding in Adjumani and in Cox's Bazar as to what the issues of incontinence are for children related to water, sanitation and hygiene, access to health services, inclusion in the community and protection from any risks. We also want to know whether the facilities that they're currently accessing are appropriate for what they need, and perhaps even more importantly, what they want and are willing to use. And alongside this, we like to really understand the attitudes of people in the communities in general towards those with incontinence and how this might then impact on the experiences of those who are already dealing with the physical and mental side of these symptoms. And then may also on top of that be dealing with the stigmatization of this issue. The idea generally is this will help us to understand how our emergency wash program can be improved for people who are living with incontinence on a day-to-day basis, particularly with a focus on children.